Over the last 30 years, remarkably little has been done to document the history of financial, therapeutic, and operational policy with respect to addiction and behavioral treatment. As part of our mission, C4 has developed a series of films capturing this important oral history. Donnawhite, RN, PhD, is a board-certified fellow at the American Academy of Experts in Traumatic Stress and is a Green Cross Foundation certified educator in compassion fatigue. Dr. White is the statewide chairperson of the Massachusetts Nurses Association Addictions Council and completed her doctoral studies in human behavior with her dissertation in compassion fatigue and vicarious traumatization in healthcare professionals. In 2007, she was the first recipient of the Fong Bressler Award for Outstanding Preceptorship from the Massachusetts General Hospital Institute of Health Professions. Dr. White is a recognized leader in the field of addictions, impaired practice, and peer assistance, as well as healthcare professional stress.
To be brutally honest, I never wanted to enter healthcare at all. I was an artist. I have a dual high school diploma from the high school and Boston Museum School of Fine Arts, so that was my intent. But at my age, women couldn't do anything diverse. So you either had to be a nurse or a teacher or some female-oriented position, and that's where my parents wanted me to go. So my plan was to make them happy, from a dysfunctional, chaotic, alcoholic home, keep somebody happy, and then go back to art and do the design work that I love. But in doing that, I found I love patients. I love being with people. I love hearing their stories. I love working with them. And at that point, I made a decision that I would stay and do it. For a while, anyways. And the more work I did, the more entrenched I became. The school that I went to worked. It was located in the city of Boston, which works with the homeless and the poor and the marginalized. So that being said, I found I was very much drawn to those people. And from that, it just blossomed, so to speak, if that's the right word, and found that I learned so much from counselors. And that was an area that I wanted to learn about. Because as a nurse, we had a very defined role. But I saw the relationship that counselors had. So I found I needed to do more work there. And that's where it all started. I'm very entrenched in education these days. I'm all over the country, and I teach for UMass Boston and the University of Massachusetts in Boston. I teach psychopharm there, and I also have nurses and nurse practitioners in community health, which I specialize in addictive disorders and now substance use disorders for the Mass General. So I have that Institute of Health Professions for them. So those are my populations, and anyone at UMass, the University of Massachusetts, can be part of those programs. It doesn't have to be nursing where I teach. Wow. Yeah, it's enjoyable, it really is. And as I was saying earlier, the mentorship that I get to do now, having had decades of what I do, and the older people that I work with, over all those decades, it was just learning, constantly learning. And Fred French was one of them. And when I look back at all the great people that I got a chance to work with, it just gives me such hope for the future that what I learned way back in the 70s, that I can bring all of that to the newer group of healthcare professionals. And, when I hear everybody, and I learn about the violence too, and we're entrenched in it right now in this country, but I was part of the whole anti-war movement, and all of that was so difficult to live through. And I marched on the streets of Boston and sang with Joan Baez and all that. And I married a Vietnam veteran who came back. And the interesting perspectives of that, I was able to meld that. So now when I do work with veterans, and my son-in-law went to Afghanistan and came back. So there's a lot And my father, who only had an 8th grade education, used to say, education's never wasted. Whatever you learned, wherever you learned it, whatever it was, you will use it somewhere. That wonderful wisdom of people. As you grow older, it's not just education, it's wisdom. I work on the Apache reservation in Arizona. I volunteer there with Joseph, who's an Apache here at the conference. And the wisdom I learned from the people, you can't buy that, and you can't teach it. You have to be with the people. And I learned there about the land, about the people, about the earth, and their spiritual guiding mentorship. So I always bring that back. And, here I am with all these credentials and all these initials and certifications, and yet I'll do stonework with people. So the blessed stones from the people, from the Apache people, help me ground for the work that I have to do in difficult areas in Boston. Some people want to rename it Recovery Road, but it's tough because when I bring my students down there, you don't see a lot of recovery there. I see young people struggling. It's gut-wrenching and it's heartbreaking, but we do the best we can, and we try to keep those people alive. And they're younger and they're sicker. And we're surrounded by a lot of, difficult work. But to do it, it's very meaningful, and I always give hope for the future. Well, one of the things I teach in the psychopharmacology course is the history of substances, and it's been around forever. All different substances, all used by all different cultures. But when I was growing up, you saw people, alcohol was the predominant drug, so you saw a lot of that. When you heard about heroin, it was a marginalized population that used heroin. It is completely different now. And even for us to talk about heroin is outdated because it's now fentanyl. So the drugs are stronger, more powerful. In the 60s riots and the early 70s, you saw a lot of the psychedelics being used, and that sort of transcended into a movement where drugs were freer, drugs were more open. Now you see the legalization of marijuana, and you have a lot of polarization about a lot of drugs. So what's usable, what's acceptable, and what each society looks at in each culture is very, very different. So it's somewhat easy for me to say, here's what changed, here's what's different, but we have to, I think, be on top of or be aware of different cultures. And how does it affect the person? What I'm looking at now is I see much less overt use of alcohol. It's still there, but you see a lot of injectable drugs, so much more, so prevalent at an earlier age. The people, the younger ages I see in the hospital where I consult with, you're looking at 18-year-olds who have been using injectable drugs for many years already. You see a lot of sexual trauma. You see a lot of traumatic backgrounds with people who have grown up with severe trauma of drug use in their home. I can quote you from textbooks. I can give you research, or the current trendy term right now is evidence-based, but I do try to stay on top of research, but I watch human behavior. And one of the things I've learned from a counselor who's also here this conference, his name is Dr. Andy Moynihan, is the therapeutic relationship is the most important thing you can do with any patient, whether you're working with a terminal cancer patient or a person with substance use disorder. And I really took cues and learned from that. So the first thing I try to do is not use power positions. In other words, if the patient is sitting or they're in bed, I try to reach them at eye level. I'll never stand, which is a power position. I do try to learn their language accept them right where they are right now and not do the judgmental role, and very clearly not have a confrontational eye contact. Eye contact can be used in different ways. So I also shake hands, and tell them my name first. There's a lot of cues that you can use, but all of that leads to creating a therapeutic relationship. And I have found over the years that it's the most important thing in working with a population that is absolutely marginalized in society. And I enjoy it. I have found in the hospital I would be called frequently, constantly, to come and meet with patients that a lot of different professionals and staff found extremely difficult to work with.
Yeah, what do we do? Help.
That's exactly what would happen. Please come up here right away. And there was one case when, the man he left the hospital, went down, found a corner where he could score, and did, and came back, and he was quiet in the bed. He was under the influence of heroin. And it was the staff I had to deal with. It wasn't Joe. Joe was quiet. And I had to work with the staff all day to help them process what they were feeling, which was anger and judgmental and resentment. And he broke the rules. Well, that's part of this disease.
Oh, yeah. We break rules.
Yeah.
The rules don't apply to us.
No. And you can make all the rules you want, but I know how to go around them. So in understanding that and accepting that person for their behavior, and let's talk about now what we can do so you can have a better life. People would always say to me, including my family, how do you work with those people? Because I have 7 certifications, I have 2 licenses, I have all these degrees, and yet every day I would go to work, I would enjoy it. Every day it was something new. It was meeting new people, or it was seeing the people that I met the day before or the week before and following up for having that discussion about what can we do to help you. When I would hear how angry they were about the food or the hospital, or I don't like the staff here, and my approach would be, well, I clearly understand that. I do. The food is awful, but do you want to keep coming back through here? Is that your plan? Because it's that. That is what will happen, or worse. So let's help you work together to have a better life.
Yeah.
The governor of Massachusetts, I think it was 4 or 5 years ago, gave all of us at the top tier in the state what we call the handshake. Gave us extra time so we could retire early. And I realize there's always a financial reason for that, but it gave me the chance to leave and then do what I want. So my role now is more education and consultant work. And I found I really enjoy that because it gives you the freedom to consult. I consult nationwide. And I consult on the most difficult of situations in patients. And I enjoy it, and I get calls for that. I also enjoy teaching a great deal because students and adult students, or whatever age they are hungry to learn. They want to learn. So if it's my legacy, let it be that, I think. I seem to have a lot of awards in my career for just that, and I'll be getting 2 more in the next 2 months, and one of them is the Mentor Award. And I said, if there's a way that I should end a career, it's with that. It's with that award, because it really says I've done what my destiny was supposed to be. When you're 21 and you start out, you have no idea. And all I've really asked as I work with Apache people, and I've learned about their world and the spiritual guide, is to ask the universe, just put me where I'm supposed to go, whatever that is. And once you learn acceptance on that level, acceptance comes in many forms, but once I've learned acceptance for that, everything is enjoyable and easier, so much easier. There doesn't seem to be the stress there was when I was so much younger. It's gratifying to do the work every day. Indigenous people all over the world have their struggles, as do we. But their connection to the land seems to be different, and their connection to the earth and the water and the air. So that part, I try to pull pieces from. I do a lot of conferences and speak nationwide, and I will bring a stone or a candle, blessed stones. And it's amazing to see the reaction to the audience when I tell them how this works, and this is blessed in the Apache tradition. And I try to have Joseph, that's here today, bless stones for me so that I can give them the best way I can to give back and say thank you. And it's amazing. And I've given them to families who have lost their children to overdose. One story is the group of students, nurse practitioners that I had, and I was able to get enough stones for the entire group of men. Now we have between 40 to 60 men in that group. So that was one project that we did. We always do a project and we give back to the hospital what we can for allowing us to be with them and the men or the women. So we had a stone for every man, and we had them in bags, and we gave them to the men at the end, and we shared with them what they were. So the amethyst is a stone of recovery, and the carnelian is the warrior stone, and that gives you strength for the journey ahead. So I asked the men to not look, but to take a stone from the bowl that we shared, and then we shared with the men what the meaning of the stone is. So it was incredibly rewarding at that time. But 2 years later, when I'm in another recovery home, a man comes up to me and he says, "I remember you. You were there with all those students." I said, "That's me." And he pulled the stone out of his pocket. Now this is 2 years later. And I'll call him Joe. And I said, "Joe, you still have that?" And he said, "I carry it every day." And he uses it, what we would call, as an affirmation tool to help him ground for recovery. And if there's ever a reward, it's not money. Those are rewards in my life. Those are the things that come back and give back, and, sort of circular. Mm-hmm. And, for whatever, I'll say to the universe, thank you. The only wish I really have is that we focused a little more on recovery. We seem to be focusing so heavily on other extraneous issues that surround the field. We need to, in my opinion, get back to that recovery is a lifestyle change, that it isn't just taking a pill or a medication under your tongue or an injection, that recovery means that you move in your life into different stages, and then you look at what will be your legacy. You don't need degrees, you don't need to have achieved a whole lot or make money. You need to have the best life you can have, whatever that is. And that's recovery. And I wish we just focused a little more on that. And that, as I end out my career, is what I'm trying to help people with. That, yes, medication is one piece of it, but there's also this other work that you have to do. And this part can be enjoyable. I think you have to look at what medication is being prescribed. Whether or not you have co-occurring mental illness and a substance use disorder, which came first, doesn't matter anymore at this point. You have to look at biologically and physiologically what is happening to you and how can we address one problem that's concurrent with the other. So you have to look at the neuronal issues going on with this person and the neuroplasticity of the brain. How can we help this person recover? And recover may mean stabilizing with medications so that the brain feels more balanced, and then at that point you can do the work. So medications are only one piece of recovery. And I think that's the approach that I take when I teach psychopharmacology. And there are many medications we have now that we didn't have decades ago that really help people with either their mental illness, depression, or their mental illness that co-occurs with substance use disorders. and all of them work. It's just being able to know how to prescribe, accurately, and not just so quickly get to know that person and know what their needs are, as opposed to prescription writing. There's a lot to it. And it comes back down to therapeutic relationship. How much do you know that person? The one last thing I really would like to say to you and to the Cape Cod Symposium, I've been with this symposium, I was trying to figure it out. I think it's about 25 to 28 years. Fred French and Fred called me years ago when I was young, very young, and I was trying desperately to learn from counselors. And he had this wonderful conference that was fairly small that was geared towards counselors. But he called me one day, and actually we were talking, and he said, "You nurses, you're all coming to this conference." I said, "Fred, that's a good thing. They're trying to learn." And he said, "Well, they're asking me about contact hours, as nurses always do." And he said, "I don't know how to write them for nurses." I said, "It's a very particular way that we write them that has to be applied." And he said, "Well, will you help me?" And I said, "Sure." Now, Fred, I had worked with all different people, all different counselors. And, some people would come to work in sneakers, we all did, or sort of casual. Not Fred. Fred was always in a suit or a suit jacket with a tie, well-dressed, professional. And here we were in Fred French's home, in his kitchen, and I'm writing objectives for him so that we could apply for nurses' contact hours. We maybe had 50 to 80 people coming to the conference at that time, and probably 10 nurses, maybe. And over the years, I have just seen this conference grow and grow. And when Fred was alive, when I would see him, we would just giggle. And it moved from another location in the Cape to here. And when Dee McGraw took over, Dee has such vision that she just moved it into where it is today. And I was stunned. Years ago, I had the hospital I worked for start approving for nurses. And, just a couple of years ago, I said to Dee, "What about a nurses track, that we have for nurses, that we gear it towards nurses in this work?" Because, doctors have their track. It's grown exponentially for physicians because this is something for years not many of them knew about. And you have the older physicians who are the guiding mentors. But now, 2 years ago, God bless Dee, she said, "Do it." And first year the evaluations were off the charts because nurses felt they were getting what they need to know in this field. We just did it yesterday. And the nurses were so excited, just to see them excited to learn about the special speakers for them. So I have watched a conference grow from 50 people writing objectives in Fred French's kitchen to a conference that is nationally and internationally known. And I just feel like every year Fred blesses this. In the Hindu religion, rain is considered a blessing. And I'm not sure everybody knows that. So when everybody grouses about the rain, I just say water is life, and it's a blessing. So that's what it's such a joy to come to this conference every year. It really is. And to see it, and to hear people excited.
You have your family of origin, and you have your professional family. And you have your family of students, and you have your family of patients that you've treated over your lifetime. That's a lot.
And I see them. I see them in the big box stores, and they're working, and they're taking their methadone, and they'll say, "I know you." And because of all the laws, I can never acknowledge, but it's just one of those gifts that comes back. I would have never imagined this. Even in nursing school, I would get reported because I had artwork all over my walls and I'd be drawing, and I had all the papers on my walls taped up and I'd be doing my design work, and I would have never imagined that I would excel in this field, that this would have even been the field that I would work in. I would have never thought that I would choose this, but the universe put me here. You know, years ago in healthcare, if you were getting cancer care or diabetic care, it was very structured, it was very accepted. Our world was marginalized, so it wasn't accepted. I worked when I was a night supervisor of the emergency rooms in a teaching hospital years ago. I would get called to the ER, and it was, here they are again. He's back down there. You know him. You take care of him. And yet, for all the knowledge I had, I would call those detox nurses because we didn't have structured protocols in the hospital. So those detox nurses were people on the phone that I would call. I need your help. And they would help me immediately. They knew what I was looking at. This is before Skype. This is before any, telemedicine. So was it the dark ages then, and what's it now? Very, very different. So it's more accepted, it's more structured, it's more formalized and medicalized, if that's a real word. That's a good thing, because we are accepted more. Years ago, I was told by my sister, as one of them, but told by many people, I was throwing my career away, working with those people. And now I am a celebrity, because I have all these credentials that I focused on addictions. I applied when I was going to grad school to all the big name universities in Boston. And when I would say, and I wrote it in my application, I wanted to specialize in addiction, I was not accepted. It wasn't that I wasn't quite accepted, but I was steered towards, you don't want to study that. You need to look at this, etc. Until I went to which is why I'm so loyal to the University of Massachusetts in Boston. When I applied there, I met with a professor, Dr. Christy Alster, who said, this is something you really want to do? And I said, I do. Then it's yours. Come here, study it, and we'll help you. And I just sat back in her office, and I said, I've been pushing rocks uphill to study this. And you said yes on the spot? And she said, come with us. So anything UMass Boston asks me to do, I do. There's not enough you can do when you're loyal to someone who's given you that gift of education. I teach undergrad nurses and nurse practitioners. For years I said they need to learn about Narcan. So now I do the Narcan training for them. And it took a bit, but I'm there. I think we have to look at it a little clearer than we are. I think there's been just a rush to keep people alive, and I will do that. I teach Narcan. I will do anything to keep a human being alive. The one thing, as sad as it is the opioid epidemic, as we call it, has brought the issue of drug use to the forefront in this country. We are the number one prescription drug using country in the world. So it has brought it to light of how we live our society. What has happened is that all the other substances that are being used have been obscured. So we don't use, it's no longer heroin, it's fentanyl. We don't use that in a vacuum. There's so many other substances that people use. So we have to look at it as a country honestly and stop suppressing one focus for the other. So I think if we can, whatever it takes, whether it's the government or universities or families, I see families doing a lot of work. There's a group that started in Massachusetts called Learn to Cope. It was started by a mother who was afraid for her kids using. And she's now created this program. She was honored in Washington, and I think she has 7 or 8 programs now. And she's moving around New England, starting groups. It's a family movement. So when families do that, then you get true, that whole carrying the torch, so to speak. They can make more of a difference because they don't have, that push against each other that sometimes universities or governments have. Families just want their families members to live.
Ego disappears in families
Yeah.
when there's crisis. Everybody
Yeah.
pulls together.
They just want their loved ones to live, whether it's by mandated treatment, which is, coerced, or in the state Section 35. However, I just want my loved one to live. I don't want to care about government regulations or who gets the credit. I just love my son, daughter, family, loved one.